Welcome. My name is Joycelyn Thomas, and I am board president of AARTH. 20 years, y'all, 20 years. What an amazing accomplishment. A historic matter, absolutely. Tonight, you will learn about AARTH's rich and strong history. You'll meet our staff and our board members, and you will participate in fellowship, and you will celebrate with us. We hope tonight will provide an insight you are not aware of and compel you to become involved on a deeper level with AARTH. We look forward to your engagement with AARTH over the next 20 years and beyond. Welcome. And now we would like for you to join us in prayer.
In the spirit of sacredness, we celebrate the African American Reach and Teach ministry and your 2 decades of faithfulness in service to the community. In a spirit of Sankofa, we fly forward while carrying the beauty of who we are and have always been, looking back to a past with great gratitude and honor, standing in our presence with celebration and anticipation, while acknowledging that with God, the best is yet to come. In the spirit of solidarity and healthy wholeness for Black people, we of the African diaspora journey on in faith, full of joyful thriving and abundance, graced with moral movement, righteousness, and focus, with a plethora of gifts and singleness of purpose to live in hope. We look forward to the next 20 years and beyond of AARTH's presence in this community and beyond. These things we declare and decree, knowing we are profoundly loved by the Creator. Amen and Ashe.
And now we will introduce our board members. We have Wesson Kiftifu, Sharon Reed, Pam Saari, and of course myself, Joycelyn Thomas, board president. I would like to take the time to introduce our executive director. Kathleen Wilcox joined our organization in April 2020 after several years recruiting for the right executive director to carry on the legacy of AARTH. She brings decades of experience in service and healthcare, both in private and public sector. We are excited about where her passions and her progressive outlook will propel AARTH into the future. Without further ado, please welcome African American Reach and Teach Executive Director, Kathleen Wilcox.
Thank you so much, Joycelyn. It is a blessing to be able to celebrate African Americans Reach and Teach Health Ministries' 20th anniversary. Thank you for everyone for being present and participating in our kickoff celebration. You know, whenever anyone asks the question, what is AARTH anyway? The answer is AARTH exists to address health disparities and inequities in healthcare services for people of African descent. We are a nonprofit organization that creates, sustains partnerships to promote healthy outcomes, educates and empowers healthcare professionals, communities, and individuals to eliminate health disparities and achieve health equity, works to advance racial equity and social justice, and responds with efficacy and timeliness to healthcare crises that impact our communities. AARTH today is the result of 20 years of steadfast leadership under our distinguished keynote speaker, Reverend Mary Diggs Hobson, co-founder of African Americans Reach and Teach Health Ministry. Reverend Mary is a graduate of Rhema Biblical College in Tulsa, Oklahoma, with a degree in pastoral ministry. Reverend Mary's introduction to HIV and AIDS occurred during her time as a volunteer chaplain at the Bailey Boucher House in 1992, where she ministered to individuals suffering and dying from AIDS. They taught her about HIV and AIDS and the impact on their lives as they were dying from the disease. It was impactful for her. And some 10 years later, in 2002, Reverend Mary and her son, Reginald Diggs, along with Dr. Maurice Moses, founded AARTH as we know it today to address health inequities and combat stigma by providing education about HIV and AIDS and its impact in the Black community. Reverend Mary Diggs Hobson continued her very important work until her retirement last year in 2021. Please join me in welcoming Reverend Mary Diggs Hobson, our keynote speaker this evening.
Oh, excuse me. Thank you, Kathleen. So good to see you as well this evening. And good evening to everyone. I also want to thank each of you for joining AARTH's 20th year celebration. We want to take a few minutes to share with you some glimpses of our history. So we've selected a few video clips about AARTH over these past 20 years. And I want to say that these only represent just a micro moments of the historical library that we have produced of about 46 videos that highlight some of the milestones that would tell a bigger story about AARTH's purpose, capacity, services, and potential. The historical library will be available for viewing on YouTube. And currently there are about 6 of these video clips that are already loaded, and the rest will be loaded as we move into October. So I invite you to just enjoy the videos that we'll be showing as they're coming up. From its inception in 2001, AARTH's first initiative to break the silence about HIV in the Black community was presented through a video titled, "Who Will Speak for Me?"
Where are you going? What road are you taking?
HIV/AIDS is the secret epidemic of the African American community. It is an epidemic that crosses all lines of gender, age, and sexual orientation in terrible numbers. It is secret because not enough of us, especially in our faith houses, have dared to raise our voices to speak the hard truth. And that silence is killing us. But the tide is beginning to turn. Who will have the courage to come forward? Who will speak for the men? Who will speak for the women? Who will speak for the children? Who will speak for me?
This video gradually opened doors through community workshops, forums, and pulpits into predominantly Black churches.
I mean, who did you talk to?
Well, I want to see, more, some sort of dialogue. I mean, I just knew I wanted more dialogue. Now, how that was going to come about, I did not know, because it was just totally a taboo and was not even talked about. So here I am, one of the most chatty people in the church, and I'm preaching and everything else, thinking, in a roundabout way, I'm always talking about, the love of Christ and how we should love and we should be accepting and we need to reach out and all that. So that in a general sense was getting to it, but not just really pinpointing certain things. And so that, in a sense, I want to see happen. But at the same time, I was looking for it to happen like from the higher up than me.
It is in our faith houses, at the heart of our communities, that we must confront the HIV/AIDS crisis.
Well, preacher, what does that have to do with us and with AIDS? I'm glad you asked. The church has been silent too long as it relates to AIDS.
Because not many of the individuals in the faith community, although they were leaders, wanted to embrace this as an issue.
It's difficult, I think, for ministers to say, okay, I need to change our theology a little bit and quit saying to you to abstain and then remain silent after that.
And as church members, we want to be involved because we don't want to be tainted. And don't fool yourself, AIDS can hit any of us. You're not immune to it.
You can't have your theology over here and a reality over here and not be able to tie them.
We want to pretend that everything is all right in our community and all right in the church when it ain't. Get real.
AARTH's first major funding was received in 2004 from the Northwest AIDS Education and Training Center, located at the University of Washington. I am pleased to say that this partnership has been sustained to this present day. Funding and support from the Northwest AETC, which is currently called the Mountain West AIDS Education and Training Center, enabled AARTH to launch its HIV education and training program with a primary focus on increasing providers and community-based organizations' knowledge about the intersections of culture and health in the lives of Black Americans. And this included African-born patients and clients, and strategies for equitable healthcare services. This partnership expanded our scope to include 5 states within the Northwest or Mountain West regional network, which includes Alaska, Idaho, Oregon, Utah, and all of Washington State. In 2019 through 2020, as the CDS2Me program continued to evolve, the need to offer services that were not only evidence-based, but also culturally informed became equally important. To create holistic and culturally relevant services meant including a combination of community knowledge as well as experience, cultural experience, and scientific evidence to deliver impactful programs rooted in local context. This work resulted in the Elders Living and Aging Well, or ELAW program, funded by the City of Seattle and King County Veterans Senior and Human Service Levy. This was an exciting partnership that moved AARTH to a multi-year funded program focused solely on serving African American elders. The aim was a culturally competent program delivery that reduced barriers to access and was responsive and relevant to the needs and interests of our elder participants. ELAW enabled AARTH to incorporate many local providers, business owners, and consultants of color to offer an array of culturally relevant and evidence-informed services that ranged from healthy soul food cooking to spiritual wellness. COVID-19 challenged the launch of ELAW, but it also provided great opportunities to establish online platforms that supported participants through AARTH's Digital Equity Project that provided free tablets and laptops, along with technology training on how to operate the devices, set up Facebook, and surf the internet. This work was supported by our great friend Twanda Hill of Hill and Associates, which turned out to be a hit for all of the elders who at last began to understand and learn how to operate their devices and also communicate with their families.
I'm going to do is if it gets loud, I'm going to leave everybody unmuted so that you can control that yourself. Unless it gets too noisy, then I'll mute everybody. But otherwise, you're welcome to mute yourself. And if you do have a question, one of the first tips for Zooming is if you use your space bar like a walkie-talkie and hold it down when you're muted, it will let you in. So just know that that's an easy way to unmute or speak.
Up until 2020, AARTH was a direct service organization. We went out into our community to meet with and to be in the presence of our elders and churches, community organizations, and partners. And while we had an online presence, like many nonprofits, our platform was designed to inform and increase awareness about who we were as an organization and the services that we offered. That really all changed when COVID shut everything down, and access to our participants and communities was severely restricted. Like most healthcare crises, COVID-19 also exposed many challenges for providing services for people of color, like access to COVID testing and vaccines. These challenges also presented two major opportunities for AARTH, which included expanding its capacity and services to establish a collaboration with Fred Hutchinson Cancer Research Center, the Seattle Cancer Care Alliance, and New Beginnings Christian Fellowship Church. Through our partnership, we were able to establish a COVID vaccine clinic for Black and Indigenous people of color. The clinic was funded by Fred Hutch Cancer Research Center and operated out of New Beginnings Christian Fellowship Church. It was fully staffed by medical professionals and stipend volunteers from AARTH, Fred Hutch, Seattle Cancer Care Alliance, Mary Mahoney Professional Nurses Organization, and a host of organizations. AARTH's marketing consultant, Twanda Hill of Hill and Associates, created AARTH's online platform and portal that also included phone services for vaccine registration that was sensitive to the needs and challenges of elders and low-income people of color. By the end of 2021, well over 20,000 individuals, including children, were vaccinated through the clinic. Yeah, I just wanted to remind everyone that the videos are available for viewing on YouTube as well as Facebook, and hope that you will have an opportunity to view those and to hear more about the history of AARTH over these past 20 years. So at this point, I want to briefly share three things with you as we move along with the program. One, I want to talk about a short reflection about AARTH and why AARTH. My late son, as you've heard spoken earlier, my late son, Reverend Reginald Diggs, and Dr. Moses, a retired pediatrician from Tacoma, and I met many times in 2001 to discuss Reginald's frustration about the lack of response and support from the Black church because of religious dogma and stigma. Dr. Moses' frustration was really about the lack of HIV services for young Black females who were at one time his patients. And I, as a mother, was searching for ways to support my son and others in our community who were living with HIV. Now, our conversations basically resulted in a lot of questions for which we couldn't find adequate answers. It's been said, and you may have heard this, that change happens when you become unbearably uncomfortable with the status quo. So we concluded that we needed to be the response to the questions we were asking. And as a result, AARTH was born out of unbearable frustration, lots of prayer, compassion, and a drive to save lives. And I am truly humbled to see what started out as conversations carved out of frustration about the impact and devastation of HIV/AIDS was having in our personal lives and well as our professional lives and our community that has brought us to this day. In that time over these past 20 years, I just want to briefly share 3 key lessons learned. One, we quickly learned that running a nonprofit was not for the faint of heart. While I officially, as Kathleen has shared, retired in 2021, our 20-year journey was filled with a lot of hard work, some heartaches and tears, and many rewards and blessings that were shared with caring families and a committed board and dedicated staff and volunteers. Secondly, we learned one of the biggest differences between conversation and vision is strategic action. And it was essential to have a vision aimed toward what the future should be, not could be, but should be, one that embodied the social, cultural framework and health of our community. And third, being people of the village. We understood that the ability to grow and sustain AARTH would take a diverse and inclusive village, which wouldn't have been possible without our partnerships and collaborations with our community members, organizations, government agencies, and our funders. Now, lastly, I want to just share a few expressions of gratitude. As one of the founders, the one thing that I am most certain about and grateful for is the grace and favor of God, without which AARTH would not be here today. AARTH's vision, purpose, the work has always been to exemplify the love and social justice principles presented by Jesus. And I'm so grateful and humbled by AARTH's current board and executive management and staff and their commitment and hard work towards continuing the journey. I'm also grateful for the support of the many organizations and agencies and funders who have partnered with AARTH over the years, most of whom are still with us today. Now, while AARTH started its journey by being one of a few voices speaking on behalf of many that were suppressed, and as well as those who just refused to speak out, I'm grateful that the work over these 20 years has played a role in helping to make it possible for everyone to speak for themselves and each other. And finally, I just want to, I'll back up here. It is really kind of customary in our culture and in my faith for elders to offer a blessing. And as such, I want to bestow this blessing upon the board, management, staff, and the community partners. And is this: may AARTH's history be your guiding light for the future, the journey forward. May your dedication and hard work continue to grow and expand AARTH beyond seen and unseen boundaries and borders to offer just and equitable services. And may God grant you the grace, favor, and wisdom to cultivate sustainable relationships and increase fundings and services that support our communities in living healthier and productive lives. Thank you.
Thank you so much for an amazing presentation, Reverend Mary. And thank you for blessing AARTH one more time.
Thank you, Kathleen.
We appreciate you.
Thank you.
And am glad that you're here. We have invited community members to share some of their thoughts and memories of AARTH in their lives, and hope you all enjoy the AARTH Community Video Hug.
Reverend Mary Diggs Hobson. This is Charlotte Ruff. Congratulations to you and the AARTH staff on 20 years of serving our community. I was your outreach coordinator almost 20 years ago when you and Reggie first started out. And I am so proud and so happy for the time that AARTH has served our community and how you have grown. Thank you. God bless you.
Hi, my name is Betty. I had a front row seat for almost 14 years of everything that was accomplished at AARTH. Congratulations, Mary and the entire AARTH staff and team for your exceptional, impactful training, education resources you provided to our community. God bless.
Hello, my name is Kathleen Wilcox. I am the Executive Director at AARTH Ministry. I am so proud and blessed to be a part of the work empowering Black people to achieve better health outcomes. Congratulations on our first 20 years.
Greetings, AARTH. Hello, and happy 20-year anniversary. It's been a great honor of mine to work with you from the very beginning to some of our early HIV and AIDS conferences at the Tukwila Community Center, to the last large one that we did over in Spokane at the Convention Center, to the work we've done the past 2 years, COVID vaccine clinics and COVID awareness. It's been a great run, and I look forward to the next 20. Cheers.
Hi, this is David Spock from the Mountain West AIDS Education and Training Center. We are longtime and proud partners with AARTH. On behalf of everyone in our organization, we want to thank you for the wonderful work that you do. And congratulations on your 20-year kickoff celebration.
Hi, welcome to AARTH's 20-year anniversary celebration. I am so glad to be a part of AARTH and all the things that AARTH stands for and represents, including providing educational information and healthcare information to the BIPOC community. Welcome and thank you for joining us.
Happy 20th year celebration to AARTH. I am wishing you many more years of service, of outreach, of educating our community. I was just reflecting on how I was the program coordinator for the chronic disease program and how much it educated me and afforded me the opportunity to go out into our community and serve. And now I am a second year MD student studying to become a doctor. So I am so grateful to be a part of AARTH's journey. And I also am thankful that AARTH has been a part of my journey as well. And I am wishing you many more years of service and of success. God bless.
Good afternoon. My name is Rena Can, and I am the Outreach Coordinator for African American Reach and Teach Health Ministries, better known in the community as AARTH. I am so excited to congratulate AARTH on 20 years of service to the community. May God continue to bless you and watch over you as you do the work for our communities. Thank you.
I remember when I first heard about AARTH, I was attending a conference back in 2004 where Reverend Mary Diggs Hobson was speaking. She spoke with such passion and love about the humble beginnings of AARTH and its vision. I was just so excited. I couldn't wait to be a part. I started volunteering and eventually served on the board. And I just have to say about AARTH, it's about real outreach, innovative services, education, and love, saving our people's lives. AARTH will always have a special place in my heart, and I'm so thankful to AARTH for all that they are doing for our community and this nation.
AARTH, we made it! 20 years. I'm so excited to see what the next 20 years has in store for us.
Thank you, AARTH. It has been a wonderful opportunity to share with community African dance and the history and nuance. Thank you, staff, and all of the volunteers and all of the participants for being great friends and supporting us through the process.
Good evening, everyone. I want to thank you for taking the time to celebrate this memorable occasion, the 20th anniversary of AARTH. My name is Sharon Reed. I have a master's degree in nursing education, and I'm proud to be a member of the AARTH board and delighted to represent a part of AARTH at this celebration. The past 2 years have demonstrated lack in equity for healthcare, along with how implicit bias can affect treatment. Advocacy for inclusion plays an important role in healthcare. AARTH is influential in advocating for chronic diseases to be from a holistic approach, along with providing educational resources and addressing healthcare disparities for African Americans. The mission of AARTH is to enhance knowledge and awareness to our community, as of many programs in which Mary mentioned. The future is to continue with providing cultural awareness. Faith and grants have kept AARTH strong for 20 years, but there is still financial need in order for the enhancement of these programs, along with adequate staffing to assist with the growth of AARTH. AARTH has been steadfast in providing resources, updated information, and a pillar to our community, which are mothers, daughters, fathers, and sons for people such as us, with special attention to our senior community needs. Challenges and concerns are approached with compassion and empathy for our community. AARTH has provided a platform that establishes relationships that help to bridge the healthcare gaps. In AARTH's mission to continue as a nonprofit organization, with being innovative in their support for advocacy, for healthcare equity, education and treatment of chronic disease, and providing resources, we need our community support. Silence does not provide financial support or open doors. At this time, we are asking for any charitable donations, which can be a one-time offer, monthly or yearly. Any and all donations are appreciated. Let us continue in commemorating the collaboration for more cultural informed programs and educating our community. Again, thank you for being part of AARTH's 20th year anniversary celebration. Thank you. And there is also a hyperlink and mailing address that will be located in the chat.
Thank you so much, Sharon. I'd like to talk a little bit about where AARTH is now, and to celebrate our position at this time. We are a lean, community-facing nonprofit organization, and you would think that we're small. We have less than 10 staff members, but our board members, our staff, our community navigators, our lay leaders, and other volunteers all represent the communities that we serve. That's important. We are also professionals educated in the fields of nursing, public health administration, social work, education, cultural anthropology, business administration, accounting, community psychology, health administration, and organizational management. Our work includes seeking, strengthening, and maintaining relationships with faith houses to work together to address healthcare issues related to our shared community. We engage healthcare providers and other professionals offering a broad scope of educational practices to influence social justice and health equity. We engage, we teach, we advocate, we extend a hand while engaging with the chronically ill, the isolated, the overwhelmed caregivers, and the families in ways that they feel seen, understood, and accepted. That's very important. And in being this kind of an organization, we are uniquely positioned to do the work that we do because of the relationships we have with individuals, other community-facing organizations, including Afrocentric faith houses, government agencies, healthcare professionals, and institutions. Our work continues to expand to meet the expanding needs of our people. And I know that I speak for everyone at AARTH saying that this is the most rewarding of all callings. At this time, I'd like to introduce our current team of amazing individuals that make up our village, and followed by a musical selection by Seattle's very own Josephine Howell.
Meet the AARTH team. Asantua Antabam, Data Entry Specialist. Kim Breland, Accountant. Rena L. Can, Outreach Coordinator. Twanda Hill, Organizational Strategist. Reverend Dr. Renee McCoy, HIV/AIDS Project Manager. Jasmine Tucker, Training Coordinator 2. Angela Yancey Watson, Lead Program Coordinator.
For those who take a walk with me to live back in our history, all rise, to face the past that we must dread, to use our strength and lift our head, all run, all rise up, please stand up. When will we rise up? Stand for those who fell for us, live for those who died for us. When will we rise up? For those of us who walk with me to live back in our history. All rise, all rise, to face the past that we most dread, to use our strength and lift our head. All run, to face the past that seems so near, to conquer all our hidden fears. All rise, all rise, all rise up. Please stand up. When will we rise up? Stand for those who fell for us, live for those who died for us. When will we rise up? When will we rise up? Stand for those who fell for us, live for those who died for us. When will we rise up? When will we rise up? Stand for those who fell for us, live for those who died for us. When will we rise up? When will we rise up?
Wow. Awesome singing. Oh, Miss Josephine Howell.
Wow, that was amazing. How inspirational. Who can follow that? I don't know if I can follow that, Kathleen.
Oh, I know. It's quite a bit to follow, isn't it?
Absolutely. Absolutely. Well, as we start to wind down our program, Kathleen and I are going to just talk to you a few moments about some hopes and dreams that we have. And for me, as board president, we're looking to recruit some board members. And so, yeah, that would be you. That would be you. Hello? Yes, hello. Did I hear a call? Okay. A vibrant board is essential for the health of a nonprofit. And I think I'm pretty vibrant, but we need some more folks. We need some more folks because did we mention that we have another 20 years and beyond? So the board is looking this next year during our 20th year to do our first major fundraising event. And we want you to be involved. So if you have very fresh and an innovative spirit, maybe even you have gifts and talents, whether you're inside healthcare or outside of healthcare, we can use your gifts and your talents at AARTH. If you think it can benefit our organization, we want you to contact us. If you want to serve the community with nearly a celebrity organization like AARTH, reach out to us and express your interest, and the office will direct you to the proper individual. So welcome to the board.
That's wonderful, Joycelyn. That's wonderful. It's good. In the recent past, we've talked a bit about aspirations for AARTH, and I know that there is one aspiration that we've talked about, you and I, quite often, and that is encouraging people who look like us to become healthcare professionals that can care for us, and all of the reasons that is a very good way of creating solutions. I'm hoping that we can maybe talk a little bit about that strategic movement. I can talk about how we hit upon this idea.
That would be great.
We are both nurses, and I have been involved with Mary Mahoney Professional Nurses Organization, and you have been in leadership with that organization for many years, and their charter is to help assist African American and African born nursing students so that they can be successful in college while they're training for orolicensure. And I think that we are both committed to continuing that work through the lens of raising up children the way that they would go.
Absolutely. And we're looking into this as we talked about aspirations as we prepared for this coming year. We talked about one of our aspirations is to find out how can we work together to not only provide scholarships for students as Mary Mahoney does, but we're hoping that AARTH may be able to provide collaborate with other organizations to provide a pipeline or a community pipeline for students of color to become nurses. And so that's one of our aspirations that we have discussed as a board and with Kathleen.
And it's something that will grow. I think just like the outcomes at Mary Mahoney, where there's really a pipeline of nursing students that enter and go through the mentorship and encouragement that Mary Mahoney provides them, hoping that AARTH is able to build that pipeline and widen it over the course of many years so that we have a good source to help individuals who want to become nurses and other healthcare professionals eventually as well.
Yeah, and introduce our community to nursing, because a lot of individuals in our community, especially young people, when they think about healthcare, they think about becoming a doctor. They don't necessarily think about becoming a nurse. And so that's really important. And so those are the things that, I think are going to be essential as we move into the next decades.
Well, AARTH has what we call community navigators, and they are actually like our boots on the ground, particularly in support of the work that we do with faith houses. And historically, there's been a specific breadth of work that they are responsible for. And we found at the beginning of this fiscal year that the work that they do should be expanded. And so we are looking for other individuals who are interested in providing that bridge in terms of time spent with folks, health units at faith houses, so that we can provide even more outreach to our church community. But it also requires knowing what the faith houses are interested in doing, what they're interested in learning about. And so we would love to engage more individuals as community navigators so that we can be more complete in our reach to our church families. So that what we bring to them in terms of education is not only good for them, but it's what they're interested in learning.
Yeah.
So with that said, we would love to engage in some focus groups in the next few months or so that we can learn directly what people are interested in learning from us.
And I would invite, I know you saw the tickler, but I would invite any of you who are at a church of any kind, or even not at a church right now and have maybe been at churches and aren't at churches now. If you're interested in participating and becoming a community navigator and or participating in focus groups, please let us know, because the only way that we're going to be able to serve and meet the need is to know what the needs are. And then also to meet that need, we need people to be engaged. And so this is we have a great program to train our community navigators. And our partnership in that is evidence-based. It's used around the world, the United States and the world. It's used globally. So I really invite you to learn more about that program.
Thank you, Joycelyn.
Thank you, Kathleen.
It's great to have a talk.
Yeah,
Yeah.
it's really fun to be able to share what our aspirations for the next decades are, and this next year. And we hope that piqued some of your interests, our conversation.
Yes, yes. Well, it looks like we're running out of time, folks.
Oh, no.
We'd like to thank all of the folks that are in attendance here and join you with a toast to AARTH's next 20 years. Cheers.
Here's to the next 20.
Thank you so much for your attendance. And we want to thank all of the funders who support us and everyone else who contributes to our AARTH.
Thank you, everyone, for being here, taking your time out of your evenings to join with us and celebrate with us. And we look forward to working with you.